come on over, Amiko. Let's have you go face down for me. Are you still wearing that? We have the next lower lift.
I decided to wear this again because it helps.
When you're not seeing me. Yeah.
Oh yeah.
So is it still moving around in the shoe?
Yeah, but I found that in slipper at home, narrow slipper fits quite well.
Yes. And the only thing that it depends on the type of shoe and what's in it.
Right.
So if there's like sheep's, you know, that fluffy sheep wool or it's slippery inside, it is going to move a little bit more.
Right.
So we talked about using Velcro,
Yes.
but that would bring it up a little bit more. This is only 5 millimeters, but you know it's enough that it was taking that pressure off that back and helping compensate. So still use that. The only thing I could think of is there's a 3M tape that you can get that's double-sided, heavy duty.
Yeah.
So it compresses and it's pretty nominal. It'd be less than 0.5 millimeter. So that's the only other thing that you can do. And Dan, maybe you're a creative guy.
There's spray adhesives that have a little tack.
Yeah, the only problem is that she won't be able to change shoes.
That's
something,
the thing.
just a tack one. That
That's why some of my clients will end up getting 2 or 3 lifts.
I like to have a few.
Yeah. Go face down.
Anyway, I show you. If I didn't use a couple of days, and I realized that if the balance of my leg is still, this is short.
Right.
So it hurts my here.
Yep.
Yes, so it goes into here.
Into
and
the groin.
hurts. And if I have this, it kind of balance.
So when we get the next one, you could put it in your slippers and keep it in your slippers.
Yeah.
Around the house or house shoes, whatever you wear. And then you can have 2 of them that you can interchange it, you know, going out, maybe athletic or slip-ons. I notice the same thing. So anytime, because I can't change the anatomical part of it, I can change only when I adjust the alignment and the nerve part of it.
Yeah.
So that very beneficial. That'll help quite a bit reducing that.
You said that I
Face
cannot
down.
use it in the socks, right?
No, outside the socks is better. I suppose you could in the socks, but I think it's better to have it outside of the sock. Yeah. All right. Face down, Amiko. And so we're going to actually get a close-up of this. If you want to see, she had a hip replacement right here. This one here, it was partial, right, Dan? It was. And you can see the leg length difference noticeably on her left one. Uncommon for most people. Usually it's their right short leg on that side. So we've been helping change some of that by getting better alignment and then adding the lift to help stabilize that. Amiko, I want you to raise this leg for me. Don't bend the knee though.
Like this?
Yes, and back down. Now this one. Back down, back. Perfect. So I'm checking the sacrum and alignment of the sacrum. That looked pretty good. Now I'm going to check the alignment of the pelvis. That made it a little worse. That made it a little bit better. You can see that right there. Now the table's going to drop. And I'm staying off the replacement here. The replacement's right in here, but I'm right on the SI joint. Now, as we get younger in life, it's not easy to do some of the traditional styles that some of you may be looking for. And so the technique of drop work is very helpful to people because they don't feel that resistance as much in through the lower back. And then I enforce it as well by using the instrument in here. This is called the ArthroStim. There's many different tools that help that chiropractors use. So for every second I'm adjusting the pelvis, better alignment. For every second there's 12 recoil adjustments occurring right there. I want you to put your left hand on your lower back, Amiko. There you go. And the leg went significantly shorter on that side. Hand down. So we're going to gently push on L5 in correction. A little bit better in there. So we have a little bit rotation, slight rotation on L5 right here. And you can see on the head of the dual probe, I'm adding more emphasis on the left side than the right. Good. Place your right hand on your lower back. That looked pretty good, actually. goes a little shorter in the second position. You can bring your hand away. So I'm adjusting the spinous, inferior to superior right there. You good?
Yes.
So you can see some chiropractors, we can get really specific in our adjusting protocol, especially where she's at, because this is her both of you guys last week at twice a week. We're gonna go to once a week and see how she does with less on that. And I think she's doing pretty good because she's been fairly stable. Both hands lower back for me. Good. Looks pretty good at L2. Hand down. Perfect. False alarm. Gotta watch for the auto eject button though.
Or they move and then they don't move back.
So I like to use the massager, one, to work on some of the pelvic muscles right here and the glute area to help with some of the gait. I like to work on the IP band. And so this is not a sander, it's a high frequency vibrator massager that helps bring blood to the area, loosen things up a little bit into the tissue so people can move and be out of less pain. One of the better treatments for back pain, neck pain is chiropractic, and you can see that I'm using a number of different techniques and modalities when helping both Amiko and Dan. You're finding it easier to move. Was it you, Dan, or Amiko? One of you said that you didn't like going to the doctor. I think it's Amiko.
Both of us don't want to go to medical doctor.
And what has been your experience here?
Good. Yeah, chiropractic we don't count as a doctor, you know. I'm saying medical doctor.
You doctor
Take that the wrong-
chiropractic.
You can
Yeah.
take that the wrong way.
Yeah,
No,
and
no,
people
no.
say that too on
No.
YouTube. They said I'm not a real doctor, but
No,
you
no,
know,
no,
doctor
no, no.
what?
No, I tell you.
So
You know,
Clarify.
medical doctor likes to bring samples and check all blood and everything,
yes,
and I don't like that.
you don't like that part?
No.
Oh, they bring samples of prescription
and
drugs.
tell you what's wrong.
You know, you have to ask yourself when you're getting samples of prescriptions if
Yeah.
they're sampling on you or what, you know, and just
Yeah.
seeing if it's good for the market.
I know that chiropractic and dentists are going to heal me, you know.
That's very
Heal.
perceptive.
Yeah.
Very perceptive. Let's have you lay on your back, Amiko. The prosthetic or the replacement here, this being the shorter leg on her because it's been made longer, I like to just traction the left leg slightly and improve mechanics there. When I do any traction here, I'm staying really light because this is not the original part. You're no longer stock, Amiko.
It's been less than a year.
Yeah.
So after a year, you can go a little bit harder on it.
It's still a prosthetic in there, so how it's stabilized is a lot different than what it was before. You have a lot of attachments of the muscles on there, tendons, ligaments, nerve structure. So it's a lot different. That's been changed in there. And how it functions, it's not you're not original part. So you know when you get a replacement part, it doesn't feel quite the same, but the pain is down. So the best thing to do in this situation is work around it like we are. Even though she'll experience some pain or minimal pain here, overall you have to look at how you're moving, feeling, resting, your quality of life improves on that. You're all set.
Thank you very much.
Happy-
Wonderful. Wonderful.
Happy New Year, Merry Christmas.
We come still, right?
Yes, one
Yeah,
more
yeah.
time this week, which is Thursday, I think.
Yeah.
And then next week we're gonna start once a week, see how you guys are both doing. So
Good. Wonderful.
thank you for watching.
Thank
I'm
you
Dr.
very much.
Dr. David Warwick of Warwick Chiropractic, Lacey, Olympia, Washington. If you're suffering with back or neck pain, give our office a call, 360-951-4504. See you soon.
Thank you.